So, Dr. Khan, when you detect that and you are aware, as most pediatricians are in our state, that these programs do exist at the DHHR level or a state level, how do you make those connections and how do we help our families and children get to those programs and vice versa?
These programs on voluntary basis, so and it's very easy to access these programs, and we heavily rely on these programs for patient population. However, as I said, these are voluntary programs, so some parents choose not to take advantage of that. And that is very sad. Sometimes there's a lot of fear that somebody from the government is going to come and look at my child. Big brother is coming and Big brother is going to watch me. And sometimes they have other social issues. Sometimes there are drugs and other issues that they don't want somebody to come to their house, as Christina was saying about the home visitation. So I do see some resistance on parents' part, but in great majority of the cases, these are utilized very easily. It's not very difficult to make the referral, and the health department does a very good job in terms of accessing these parents and providing them with the required resources.
So if you need help, and obviously if first step is to go get a well-child exam, and if those development delays exist, they will be caught hopefully in a timely basis. And where there's so many resources available, I think it's important for our viewers to understand to be able to get those done. But once again, I think these are individuals that are providing these services that are also living in those communities, able to visit you and do that. I want to shift the focus a little bit, still stay on children, but to the issue of immunizations, the shots. Dr. Khan, you've been the champion of strong, I would even contend, the strongest immunization policies in the nation. West Virginia has, until now, it has had some of the strong policies, one of two states in the nation to have very strong laws protecting our children. But you know, what we have done now is we have even stronger. So we are certainly a model state in the nation for our immunizations. So would you like to talk a little bit about how do you see that, and how do you see that going forward, and what are the challenges as well in that realm?
So what you're referring to is that the state of West Virginia does not recognize any non-medical exemptions to immunization for the school entry. So there are only 2 states in the union which have those kind of laws. Despite that, despite having these rules, West Virginia is not among the top 4 or 5 states which has the highest immunization rates. And the reason being that our access is not there, that there's increasing fear about the vaccine. And this is very natural when you don't see the diseases that has been prevented and abolished by the vaccines. People don't understand the importance of these vaccines and vaccination programs. So when it comes to getting the immunization time, we are nowhere near the top, not even among the top 10. But by school entry, and because the system has those teeth in the system, they cannot go to the public school until they have all the required shots. So we do catch up, but there's a lag, there's a delay. We are, based on our rules, and especially with the recent outbreak of measles in multiple states, starting from California, the lot of states, they are looking at our model and trying to strengthen their own immunization laws and rules. We unfortunately still get some pushback from the legislation and other anti-vaccination groups. But so far, kudos to the legislators in our state. They do understand the importance of immunization and immunization programs, and we have been able to maintain that pushback at bay.
Yeah, and they take it very seriously, as well as all the medical societies, because we are here to protect kids at the end of the day. And you're right that in our state, when kids go to first grade, because of the mandatory laws, our immunization rates shoot up. But until then, they're still vulnerable. And some of the new changes in the law will allow now that child daycare kids going there to obtain the same level of benefit as the kids going into first grade do. So I think that is, you're right, that's a great, hopefully, achievement, and we'll see those changes happen. For those people who often talk about immunizations and as a challenge to that, you know, obviously there's those that'll be very much impossible to convince because they just will not agree to it. But others, I think education goes a long way. Would you agree to that?
I think that you raise a very good point. I was just recently doing some research about the immunization for a lecture that I had to prepare. And I went on the internet and I saw so many very scientifically and authentic looking sites, and I thought this was the real thing. And then when I read through, this was all misinformation. And
Absolutely.
now with the advent of information superhighway through the internet and all those things, the access to these false immunization is out there.
Sure.
So general public who doesn't have all the skills to analyze what is true and what is not true, it's very difficult for them to come up with the right conclusions. I think the myths and wrong information about the immunization is out there, and it's increasing. The anti-vaccination groups are very savvy about these things, and it's our role to provide the right information. Immunizations over the 50, 60 years since they've been out there, these are the safest and most effective way to prevent these diseases, to improve the overall well-being of our public population. Having said that, I want to make clear that I'm not saying there's no side effects. There's always anything and everything you do, there's going to be some small risk. But when you balance the risks and benefits, the benefits of immunization programs outweigh the risk by a huge margin.
Right. And the fact is that vaccines are amongst the most studied drugs.
That's
There's
right.
registries available if there are challenges, and so they have the best safety net system compared to it. Speaking of myths, also, Christina, I want to ask you, does your office also encounter similar type of challenges in terms of, we mentioned Big Brother a little bit, but are there resistance to the programs, or what are those barriers that could help you expand further?
We do encounter barriers. I think one of the biggest myths that we encounter is that we're often mistaken for Child Protective Services. And we're not coming in to take anyone's children away. We're there to help families stay together and remain as a family unit. We encounter, that's probably our biggest challenge to getting visits in the homes and gaining access into people's homes, is that misconception that we're there to do the family harm, and we're in fact there to help in every way that we possibly can.
And I think that's you make a very good point, that I think as an agency, the Department of Health and Human Resources, working very hard to do more emphasis on families staying together, staying at home. I know it's been one of the champion causes of Secretary Bowling as well, to make sure that there's more things that can be done at home with the family units staying together. Speaking of that, one of the issues that I wanted to talk to you also about was the idea of oral health in children, because I think that's another issue that we often get forgotten. What are some of those challenges that we have, and what are the good things that we are doing about that?
Well, we face a lot of challenges in the area of oral health. Our state has some of the worst oral health in the nation, as you are aware, and we're working very hard to try to eliminate the barriers that kids and families face to getting that health care. One of the things we're trying is to try to get oral health services available in as many school-based health centers as we can. And we're focusing those efforts on trying to get school-based health centers to focus on putting the protective sealants, the plastic coating on kids' teeth when they're in early elementary school, so that their teeth are protected throughout school from cavities and tooth decay.
Sure. So school-based health centers are those, for the viewers, those centers that exist attached to the schools. There's a number of those across our great state, and putting those protective sealants helps, once again, a preventive aspect of it. Dr. Khan, how often are you seeing in your clinic kids coming with protective sealants? You're a pediatrician. You have a focus on kids and a lot on infectious diseases in kids, but that still concerns you, correct? I mean,
I'm glad that you're bringing out the oral health, because this is a big issue, especially for the state chapter of the American Academy of Pediatrics. We took that issue up for a few years ago, and you're right. They're supposed to get all those ceilings and stuff, but by the time they go to school, this is already too late. We need to start doing these things by 2 years of age. Once they have molars, they need to apply that fluoride sealing to prevent any cavity formation. West Virginia is always is a target for all the jokes about the dental hygiene and then tooth decay we need to do two things. Number one, educate the population in West Virginia. Number two, apply preventive measures earlier on. So
Sure.
with the state chapter, we are starting a program where not the dentist but the primary care pediatrician, they should be able to apply this
Sure.
dental varnish starting 2 years of age, once the child has the molars,
Yeah.
to prevent these tooth decay. And then proper dental hygiene habits earlier in life is extremely, extremely important, not starting 4 or 5,
Yeah.
but maybe 1.5 to 2 years.
Yeah, I mean, it's so amazing that things we used to think about 10, 15, 20 years ago, science changes so fast. You know, as you are obviously aware that studies have shown that, you know, the plaque in the arteries in the heart start to develop at a very young age.
Yes.
And that's why I think you recommended to shift from full cream to 2% to skim milk earlier and earlier in life so that we prevent that. Same way, I think the science has shown us that the tooth decay really happens very early, and folks need to be talking to their pediatricians, if anything else, about oral health as important as anything else.
Yeah, because we see a lot of these kids who come in and they have their baby teeth and they already have dental caries, and a lot of parents feel, oh, these are baby teeth, and so they're going to get a new set of tooth.
Yeah.
The thing that I worry about these kids is that they don't have good dental hygiene habits.
Yes.
And if these habits are not instilled into them earlier on, they're going to have the same process with their permanent teeth as well.
Yeah.
And that has a lot of social implication, not just health implication.
Yeah.
If you lose your teeth, then it has a lot of psychological implication as well. And you know very well the health implication of dental caries and tooth decay.
Yeah, absolutely. And people also now are getting more and more aware that oral health is where it begins. It can impact the rest of your body. It's a very important part of that.
That's
so
right.
I'm glad we have had the opportunity to discuss that.